Yes, black T-shirts. Look at you today.
Do you like it?
Yeah.
Did some research.
You did?
Yeah. Most successful podcasters wear black T-shirts. And hopefully, combination of Christy and the black T-shirt, this episode will go viral.
Oh, you see what he did there? Measles virus, viral.
Can I get vaccinated from the black T-shirt?
I'm Lloyd Finks, MD.
And I'm pharmacist Dr. Shannon Finks.
Welcome to the ZUP podcast. Here we take an intentionally different approach to the practice of medicine.
That's why our podcast is all about answering your burning questions and challenging the status quo in the healthcare industry.
Right. All while making medical information digestible and accessible for everyone. You ready to stir the pot?
Let's get cooking. We are so excited today to bring to you Dr. Christy Michael. She's an associate professor at the University of Tennessee in the College of Medicine Pediatrics and has been in allergy and immunology for about 20 years. And as you can see, the banter has already begun between my husband and this really smart person, this RSP.
RSP, really smart person.
And we had to bring in
somebody who had a clue what they were talking about this.
We had to because we have to talk about another danger that is presenting in Memphis, and that's measles. Can I say that out loud?
Very, very quiet.
Okay.
Yeah.
Well, let's. Why don't you, Lloyd, talk us through why we're even having this conversation?
Sure. The conversation with Christy is really important because the question is not really about measles. Although I think we should talk about it a little bit and talk about it because most of us in practice certainly of my age saw measles maybe a little bit at the very beginning and haven't seen it for 20 years, right? It's been gone. Right? It has been completely eliminated.
Completely eradicated since 2000. So.
Right. So like whack-a-mole, all of a sudden, measles is back and we have an outbreak. And now we are starting to see that the spread of that outbreak, either from the epicenter of that outbreak or from international travelers.
So the epicenter, let's define the epicenter of this outbreak, and that we're speaking of where?
Texas.
Uh-huh.
All right.
Yep.
They do it big there.
Yep. Okay. So why are we seeing an outbreak? Why has the disease been eradicated since 2000, and why are we now seeing an outbreak and are worried about travelers or spread of disease to Memphis, Tennessee?
So here's the interesting part. If you look at these epicenters of any outbreak, there is usually either a physiological reason. For example, there is a sect of conservative Jews who live in a particular part of the country who are more susceptible to particular inherited diseases. Mm-hmm. And there are cultural practices that are more common in certain parts of the country. Interestingly enough, also conservative. So there is a pocket of individuals in this part of Texas who have opted not to vaccinate their children. And as a result of not vaccinating their children, measles has recurred.
Okay, so we could talk a lot about, we could go down any number of rabbit holes, but first let me just ask Dr. Michael, who's allergy and immunology, the vaccine principle. Why are we talking about people not choosing vaccines, and what is the potential harm or benefit from vaccines in general for measles?
I kind of want to go back to why we have a vaccination for it in the first place, and it's because, prior to, and I have to look at my numbers because this isn't something that I keep on hand, but before the vaccine was available, it was responsible for 48,000 hospitalizations per year, and measles killed 400 to 500 people every year.
Okay. Yeah.
And so it was a huge problem, right? And it's a virus, and viruses are notoriously harder to treat. Mm-hmm. Bacteria, we can take an antibiotic, but a virus, we can't. Mm-hmm. And once we had the vaccine, the goal has always been to have a good 95% or more people in any given area vaccinated, because then either the people who haven't been vaccinated yet, like babies, or can't be vaccinated for other medical reasons can still be protected in those instances if enough other people are vaccinated.
So you're talking about a concept called
Herd immunity.
Yes.
Yeah.
But I think it's a very difficult concept for people to understand. You don't need to vaccinate everybody, but you do need to vaccinate statistically 95% or more of the population. And if you fail to do that, progressively, the fewer people that you vaccinate, the more likely the disease is to be transmitted. And we were talking earlier when we were hanging out, and I said, to me it sounds a lot like pollen, right? And you could actually do a concentration of anything, but let's just talk about pollen and allergies. During pollen season, pollen's probably around, year round in some form or another, but during pollen season, there's so much more of it. And the concentration, the amount of pollen in the air is so much greater that those of us who have allergies are more likely to suffer more frequent and more severe allergy symptoms. And so I like to think of viruses as exactly the same way. If you can go ahead and thin out the amount of virus in the community, then you are more likely to catch it from somebody or to transmit it to somebody else. So that's the herd immunity that we talk about. You have to immunize enough people, keep them from getting the disease, so that even if one person does get the disease, travels from overseas, comes back and has it, they cannot transmit it. And measles is famous for this because you can catch measles waving at it. I mean, it is highly
Very
contagious.
Like more contagious than what?
Anything.
The flu, more contagious than COVID, more contagious than the common cold.
Any other virus that you can imagine.
It takes a very low concentration of virus, and it transmits 15 to 20 feet through the air. These are very difficult studies to do, right? But the general consensus is it is one of the most, if it is not the most, contagious upper respiratory disease.
So there's so many questions that I have, but let's just start with kind of what is measles aside from a virus? And you mentioned that it can kill. How does it present?
Usually about a week or two after exposure is when you would see the first symptoms. And generally we were always taught in medical school the 3 C's, cough, coryza, and conjunctivitis, right?
Yeah.
You remember that?
I do, but I don't remember what coryza was. I think
it's just like watery eyes and conjunctivitis red. That's a good point. We should probably look that up. Coryza is not a word that I use every day.
No.
And in fact, that's the only sentence I can use it in.
But even despite the 3 C's, I think the general population thinks of rash being a presenting symptom.
Sure, but okay, rash is such a common finding also, right?
Yeah.
So now you have a typical viral onset, right? We even use that term. I'm feeling a little virusy, right? Maybe a little feverish.
Allergies can present that way,
Absolutely.
Right? Going back to the pollen.
You can have headache,
the 3 C's with allergies.
Yeah. So here's the problem. If you feel feverish, right? You got a little headache. You'll just kind of conjunctivitis, and you got a little coryza. You got a runny nose. You can have a cough. All right, and you have this rash. And rash presents. Oh my gosh, one of the major causes of rash is a provider giving amoxicillin, an antibiotic, in a viral disease. It causes a viral prodrome of a rash. Mm-hmm. So now you're sitting there and go, yeah, looks like a rash, looks like fever, looks like a virus. So how do you differentiate is the question, right? So how do you differentiate? First of all, you got to be really aware, and you got to start looking for it.
That's right. So you got to think to look for it.
Right. Mm-hmm. And putting in a plug for the CDC here, the weekly morbidity and mortality report, right? The weekly M&M is critically important because you can track these infections as they move across the country. And so as you start to see it approaching Texas, Arkansas to Tennessee, you can start saying, okay, I need to really start paying attention, need to talk to my clinicians and tell them to be aware. The other thing, Koplik spots. Do you remember that?
I do.
Yeah.
Although I can't say I've ever seen them.
can't say I've ever
And
seen
they're not
them
the first.
either.
I do believe the rash precedes the Koplik spot.
What are Koplik spots?
So they're in the mouth.
Okay.
And I think they have a little bit gray appearance, but you can see them like on the inside of somebody's cheek.
I think this is so important is because so few of us have any experience with this. We were taught Koplik spots, right? But none of us has ever seen Koplik spots.
I would like to ask from a parent's perspective. Say I am young enough to have a newborn.
You are, my darling.
Thank you. Thank you so much. And I've got a newborn at home and they're unvaccinated because they're not old enough to get a vaccine yet. What are the symptoms that a mom needs to be aware of? Because forgive me, but it's hard for me to think, okay, runny nose, runny eyes, that's a long way from death from a virus, right? So what do I need to be worried about? What do I need to be concerned to look for?
I think, if you see that, you don't want to go straight to measles, right? I mean, you might, if you've had a known exposure or if you've traveled overseas or to an area where they're having an outbreak, because most people are getting them coincident with exposure in an outbreak, because again, it's so readily, spread from one person to another. So I think that context for sure. But I also think high fever is going to develop. Mm-hmm. And, you're going to have a rash and a high fever, and the kid is going to look pretty sick.
I think that's the answer. And I think if you will think back to the last 3 or 4 years when we had babies.
Mm-hmm. 3 or 4 years ago. Yeah. Mm-hmm.
Yeah. Right. There's a point where you simply call the pediatrician. I mean, and I agree with Christy entirely. I mean, if our kid presented with crying, miserable, right, maybe febrile because they can spike some pretty good fevers when they're little ones, right? And a rash, what would you do? I mean, you wouldn't say, "Oh, this will pass." I mean, because you want to make sure, and you'd be calling your pediatrician. I think the question I thought you were working towards was how early can I vaccinate?
Well, we'll get there.
I'm sorry.
But I'll also
I'm sorry. I
keep the
rushed
cart
you.
behind the horse.
I'm sorry.
To you, because pediatrics over here, what does it present the same way in adults? And are adults at risk? Because what if you are immunocompromised? What if it's been a very long time since you've had an MMR vaccine? Are you at risk?
I don't even know where to begin in all of that. So let me try to pick that apart. When you say at risk, do you mean at risk of catching the disease? Mm-hmm. Look, simple answer. If you're not immunized, and if for some reason you're not able to be immunized, some folks genetically just are they don't respond to vaccines. They don't produce the antibodies. So if you're one of those people, if you're receiving immune compromising medications, maybe cancer chemotherapy.
Or transplant.
Exactly. You're at risk of catching measles. All right. So let's just start with that. Then what are you asking at risk for? A risk for dying? And that's a fascinating question because these viral illnesses, you have to understand that, they're going to pick off the weak. All right, they can certainly do that. But if you look at the 1918 flu pandemic, right, the vast majority of people who died there were young, healthy, fit individuals, military recruits, college students. And there was probably 2 major reasons for that. One is they were more likely to be infected because they were in concentrated quarters, barracks, dormitories, right? And the second thing is they mounted this incredibly brisk immune response. Their lungs would fill with fluid from the inflammatory response, and this was before we had ventilators, this was before we had steroids, and a way of treating these very brisk and very dangerous reactions to the disease. So the troubling part about diseases like the measles and flu is that you are not protected, you're not safe just because you're buff and fit and eat a well-balanced diet. Unfortunately, that may be the opposite of what is true. You have a very high risk. And just before we say, well, thank God we don't live in 1918, it's 107 years later and we do have ventilators and we do have steroids. Yeah, but let's think back not too long ago to COVID when we ran out of ventilators, we ran out of ICU beds. And so, so you can't just say, if I get sick, somebody's going to take care of me. Not true. You cannot be guaranteed that somebody is going to be able to take care of you. So what is the solution? Don't get the disease. That's the answer.
So let's talk about not getting.
So yeah, not getting the disease is the vaccination is very, very effective. You know, when we think about the efficacy of vaccines, obviously we want it to be high enough. And, you know, there's certain vaccines like the flu vaccine that we change every year. Somebody studies and they say, which types of flu are we going to have this year, we think, right? And those are the ones they put in the vaccine. And some years are more protective than others. Sometimes it's not perfect. They use epidemiology, which is the study of where disease is and what they're seeing out there. And but the measles is different because it's very effective. The flu some years may just be 50-50.
Right.
You know, it may be a coin toss, but the measles is protective, and it's one shot. I've seen two different estimates. The CDC site says 93% protective after one shot. And after the second, 97%.
Which is pretty remarkable, right?
It's pretty great.
In the world of protection,
vaccine, right?
97%. And even the cooler part of that is it's lifelong immunity.
It's lifelong.
Yeah.
You don't have to get a booster necessarily, you know?
Yeah.
And so if you lived, you know, if you lived long enough ago that you were somebody who was likely to be exposed to the virus, then you're protected probably.
So that was before
57.
1957.
Yeah.
Okay.
And then there was a small window where they were using a killed virus that was a little less effective than using a weakened one.
Yeah. So middle 60s. Middle 60s.
So let's say you were born before 1957. We don't have to have another conversation about this right now. Or did I misunderstand you?
No, you didn't. You didn't misunderstand me. It's the question is, are you worried? And there's a couple of answers to that, right? So there's I'm going to throw one more piece of the puzzle in here just to make things a little more complicated. Just recently, we started beginning to understand, and for those of us in the field, reading about immune amnesia. All right, and I'm dropping this on you. This is not something that
an immunology
we've
concept.
talked about. No, it's fascinating to me, and I don't think it was unique to COVID. I think it can happen with other diseases, and maybe even including measles, if I remember this correctly. But there is.
You're right this time.
Huh?
I just wanted to give you that. You're right.
So few times.
You're
I
welcome.
appreciate the
You're
encouragement.
welcome.
So you can actually be properly immunized, and if you are immediately after, and nobody knows the period of time, a viral illness, let's just be broad about that, okay? You have the potential to have immune amnesia where your body, although it has been trained to look out for measles, right, now completely loses its mind. It has no interest in life. It lies around in bed. You know, your immune system goes, no, I just don't feel like getting up today, and does nothing. So that's the only other, you know, precaution that you have to have. And this is way out there. I mean, this whole concept is way out there, and nobody knows, you know, if it really matters. Concepts from the practice standpoint is proper vaccination gives you lifelong immunity. And the vast majority of people, you know, running around out there are going to have lifelong immunity. If you have a doubt, for example, if you were vaccinated during that period of time where they were using a killed virus,
Or if you're not sure.
or if you're not sure, the current recommendation is just get another shot. Okay? Don't sweat it. Go down to your local, immunization clinic. You can probably get them at the health department. I haven't checked. But go there and say, I want an MMR. And they're going to say, well, haven't you already had it? And say, not sure, don't remember, lost my vaccine records, changed my name, give me the shot. And the side effect profile is so low, the risk is so low, that the potential benefits far outweigh it. All right? And your insurance company, God bless their little hearts, may not pay for it. And so you're going to probably you might wind up paying $100, $115, something like that for cash, and just say, thank you very much. I would love to have another MMR. And the third option, as we know, is to go ahead and check a titer. and that is the measure of the amount of antibody in your body for measles in particular. And that's Christy's area. I mean, I'm so far out of there.
Just a comment just on the concept of vaccination in general. Basically you have this army of white cells in your bloodstream, and they have different jobs and they have different assignments. I don't know if you call it Army, Navy, Air Force, Marines, however you want to think of it. But there's one particular type of white cell that's responsible for making specific weapons to fight specific diseases. And we call those weapons antibodies. And so what happens when you get exposed to it is you make those weapons. If you get a vaccine, it tricks your body into making those weapons in the absence of the real infection, so that when you do get exposed, you're like, oh, I already got the stuff to fight this. I've been stockpiling it.
Yeah.
And so that's sort of the idea of generating antibodies. So what you can do is you can go back later and look and say, okay, did they respond appropriately to this vaccine? And there are, of course, some immune problems where people can't and don't, and so that's a whole other conversation.
Sure. But, so maybe a titer would be appropriate in certain scenarios, but it might not be necessary for all people.
That's right.
I don't think it is necessary.
I don't think it's necessary. Yeah, some people may want to know. Some people may say, if I know I'm protected, I'd rather not get another shot. I'd rather just get the titer. Some people might say, man, I don't care what the titer is. Just give me the shot. And some of those decisions you can discuss with your own provider, your own doctor, your own, and figure out it based on what matters to you.
So we're talking about the context of adults right now and someone who can make that decision for themselves. Right. Let's talk about the neonates, the pediatric patients that aren't old enough yet to get a vaccine.
That's right.
Let's talk about them for just a little bit, for our parents who are listening.
I mean, unfortunately, the kids are particularly vulnerable. Of course, whenever we talk about, people who are vulnerable to diseases, obviously the very young and the very old are the first one we always mention, and it is because your immune system is not quite shining bright yet, or it's already done shining bright on the other end.
Why do you keep looking at me while you?
Because you're sitting across from me.
No, that's really not the reason.
The black shirt?
Because you're wearing a black
t-shirt. And the big guns. Yeah. I got it. Okay, thank you.
You're welcome. Of the cases that we've seen so far this year in the United States, it's twice as many as we had last year already. And we're not even at the end of our third month. Well, we are, I guess, technically at the end of the third month. But a third of those cases are in kids under 5, and a half of those kids ended up being hospitalized. And so those kids are a little bit more vulnerable. But we don't start vaccinating until 12 to 15 months. That's when somebody would get their first MMR. Now, in the instance of an outbreak, you can give it as young as 6 months. But the response from your immune system, your white cell army, is not going to be as strong. And so you then have to go back. You still have to get the 2
additional vaccines.
In addition,
to make sure that you have immunity.
Okay. So if you're a parent out there who's listening who has a 6-month-old, it may be okay to talk to your pediatrician at this point in time about immunizing early, but the result of that may be you may have to go ahead and get the additional 2 vaccinations after this first go around.
So I'm listening to this, and I'm reminded there was a comedian who told a story one time about riding in a helicopter, and he was terrified. And he said he had a plan that if the helicopter started to go down, right, he would just ride it all the way down to the ground, and just before it hit, he would jump up. And he was fully convinced.
Brilliant.
He's not around. So I'm prompted to ask. We have one case in Shelby County right now, right? If I chose to go ahead and play the odds and just say, well, not enough. Okay, there's 50 cases, there's 100 cases, 150 cases, 200. Whoa, there's 250 cases. I need my shot right now. How long does it take to take effect? And
about 10 to 14 days for the first immunization, correct?
That's right. And it may take a little longer, just like we all look different. We might respond a little differently.
Right. So, okay. All right. So really not a great bet, considering I could
Well, you're not going to get an immediate immunity from any vaccination.
Yeah.
Same is true.
Because you got to give your cells time to make the weapons.
Yeah.
The special weapons.
It's a special
order process.
Yeah.
That's right.
I got it.
Special order.
following the suggested vaccine schedule of 2 doses should provide lifelong immunity. Everybody can take a big old deep breath and relax. Right?
I'll do it too.
Okay.
Yeah, that's
All right.
great.
So there are exceptions, those who might have been immunized in the mid-60s, obviously those who can't be covered because of chemotherapy or transplant. All right, I just want to emphasize that because the vast majority of the population who has chosen to be vaccinated has lifelong immunity. And so what we'd like is a few more people vaccinated so we can achieve herd immunity.
I mean, the vast majority of the cases that we're seeing are in unvaccinated. And by that, I mean 97%. There may be another 1% that have only had one vaccine.
And just going back, because I'm summarizing, because you guys were talking about herd immunity, and the goal is 95% to protect the masses, but we've fallen behind 95%.
We have in Tennessee. It's different.
In some pockets, and especially in Texas, where the outbreak began.
In these pockets,
so,
right. Even in Tennessee, although we're not horribly, in Shelby County, we're not horribly behind, there are still pockets that have less than 70% immunized.
So if you're in that community, your children who have not been vaccinated are the ones who are at risk.
And it comes back, is that community around us? So, and it's hard to say. Nobody wears a sign that says, I'm not protected or I am protected. We might get there before this is all over, but it's not there. So does that lead us into RFK?
Mm-hmm.
Can I do that?
Mm-hmm.
Yeah. So the guy gets a lot of press, and he gets a lot of bad press. And he has some ideas that I'm not completely opposed to. For example, challenging why fluoride is in our water. I mean, I think that's a good question, and I think he asks a lot of other really good questions. And I think nutritionally he pushes.
Absolutely.
He makes a very strong argument.
Yeah, I mean, it's never a good answer. The reason we're doing this is because of the way it's always been done.
Right.
That's never a good answer.
And particularly as the years march on, right, I think in virtually everything in medicine, we should be asking ourselves all the time, is this still the right thing to do, right? And we know that there's a complicated conversation there. What the heck is this about cod liver oil, and does it make any sense?
Yeah, I think
and measles.
Yeah. Can I answer that, or can I at least attempt to? And you guys weigh in.
No, because you're an RSP also.
Oh well, thank you. Yeah. That's very kind.
We're looking to you.
Wow.
We want to hear what you have to say.
No, I think pharmacologically, what has been emphasized in the press is a dose of steroids or a dose of antibiotics or boosting the immune system from the vitamin A or D that's found in cod liver oil. Those are not preventing disease. Those are actual treatments, if you will, the steroids and the antibiotics for kids who might be hospitalized with a secondary bacterial infection or pneumonitis.
Very important that you say that too. Very
caused
important.
by measles.
Very important.
Right. That is what will kill a child. Right. And those are treatments that are only secondary. There is not any preventative therapy or an antiviral that is treating measles.
The other thing that struck me is that 1 in 20 kids who get the measles will develop pneumonia.
Yeah.
Okay, that's high.
And that's a CDC statistic.
And we toss around the word pneumonia, and I think people have a vague concept that it's something in your lungs, but it's basically an infection within the lung itself. And there's a number of different causes. There are bacterial, there's viral, there's fungal causes for pneumonia. But it's very important to understand that a viral pneumonia does not respond to antibiotics. You might worry that this is going to turn into a bacterial pneumonia, but it doesn't. The viral pneumonia does not respond to antibiotics. Steroids can be life-prolonging, perhaps life-saving, but they don't treat the infection. In fact, very often for those of us taking care of very acutely ill people, it complicates the issue. It complicates it. And so, it's very important to understand that viral illnesses are ridiculously hard to care for when they get out of control.
So the bottom line of this podcast and this information today is really just to ease people's minds. We aren't probably going into a second pandemic just 5 years after the first with a measles outbreak in adults who have been vaccinated. However, the most vulnerable are our children, and the most effective means of preventing measles in our community is vaccination.
Yeah.
That's correct.
Yeah, I think
Absolutely.
Nicely done. Yeah.
If we can help you in any way, give us a call at 901-701-7010. Thank you, Dr. Christy Michael, for being here with us today. And
Thank you.
I'd love to have you come back and banter with my husband. I cannot keep up with you two. So happy.
Yeah. Love to have you back. And it's a gift to have your experience and knowledge.
Thank you.
Yeah.
You're welcome.
All right. Thanks, everybody. We'll see you next time.